Hi, so this is one of two videos that's being made in response to a dear friend of mine who posted recently that she was having a lot of pain in her hip after she had hip replacement surgery. And I'm coming at this question as a doc who works in rehab, was worked in rehab for a lot of years. And so I've definitely seen at least 1,000, maybe a couple thousand people after hip or knee replacement surgery, looking at, what are the obstacles to them recovering, whether it's pain or other functional issues. And so pain can be a big thing, and it can make it hard to get up and start walking and moving. And the ironic thing is, getting up and starting walking and moving is one of the main things that can make the pain get down. So the question is how to break the cycle and help the person get back on their feet. And so we're going to do two parts. One part is sort of talking about the overall issue and what we have to think about and what's important in the question of getting back on your feet after hip or knee replacement surgery. And the second part is going to be just a guided meditation, which I've found to be effective in literally hundreds of people who are trying to recover. And so we'll talk a little bit about why that matters in this video, but then the next video is just going to be, let's do the meditation so that's practical, get to the point, something that you can do at home or in the rehab hospital, wherever you are. So let's start about talking about the issue. Surgery is trauma, frankly, and it's controlled trauma, and it's trauma that sometimes needs to happen, but it's trauma nonetheless. And so there's a number of different pre-existing things that can make a person more reactive to that trauma, and make things more difficult in recovery. And this is some things that are proven, some things I've just seen dozens and dozens and dozens of times. So someone who's got a pre-existing pain disorder, and that could be neuropathic pain, or it could be spinal stenosis, it could be fibromyalgia, it could be diabetes with unknown sort of little bit of neuropathy. These are all conditions that can make the pain transmission pathways more sensitive. And so what can happen is, imagine you've got a Walkman or an MP3 player, and you're playing music through that, and you're playing it on a tiny little speaker, the device itself, and you can kind of barely hear it. And then imagine you take that same device and plug it into a huge surround sound system and turn the volume on 8 out of 10, and it's blasting loud. So that amplifier circuit is analogous to our pain transmission system. And so all the conditions that I mentioned are things that turn up the pain transmission. The fact is that surgery itself and trauma itself, any direct injury to nerves, increases the sensitivity of the nerves. But people who have certain pre-existing conditions can have an even greater increase in sensitivity to the nerves. So it's a tough situation. So you got to step in and ask, well, what can we do to reduce the sensitivity of the nerves themselves and also the overall pain transmission system? And then we also have to look at local stuff right at the surgery itself. Some surgeries just go bad. The surgeon, for whatever reason, it didn't go right. Sometimes they have to do a lot of really aggressive hammering and drilling to make it work, and that's trauma to the bone and surrounding tissues. Sometimes the tissues themselves react for reasons we don't always understand, but a lot of people develop more swelling. A lot of people develop a lot more tendency towards tightness and spasm in the muscles around the joint that gets operated on. And so there's naturally going to be a lot of swelling. Like we talked about, surgery is a trauma, and the body responds to trauma with inflammation. That means opening up the blood vessels so all the fluid flows in there, and recruiting of immune cells because the body's experiencing danger, danger, our boundary's been compromised, and so it activates the immune response to help the body deal with whatever is broken through the skin and broken bone and all that kind of stuff that happens in a surgery. There's one other thing I forgot. I'll get back to it. In any event, so there's trauma, there's naturally swelling, there's naturally immune recruitment. In somebody who has a tendency towards swelling, or a tendency towards inflammation already, there can be more of that. So a lot of times that's part of the issue too. So let's get back also and just remember a framework that's really important, which is what I call the three M's, right? And there's three interconnecting circles. Imagine a circle intersecting with a circle, and then a third circle, and in the middle point is where the action happens. And these three M's, these three circles, are mechanical structural stuff. So like what's going on with the tissues and bones and muscles and joints, the structural stuff. What's happening with the neuromuscular reflexes that control muscle tone and muscle spasm. That's a huge aspect of this. The second M is metabolic or biochemical stuff. So that's where we start thinking about people who have pre-existing nerve damage. The nerves are irritable because they're not as stable biochemically. People who have nutritional deficiencies, magnesium deficiency, B12 deficiency, vitamin D deficiency, these are things that can make all of the tissues more susceptible to pain. Hormonal issues like hypothyroidism, hyperthyroidism, somebody with inflamed disorder like lupus or rheumatoid arthritis, or even osteoarthritis, which has a kind of an inclination towards inflammation and a tendency towards metabolic stress, which we call oxidative stress. That's going to make all of those tissues more irritable potentially and make the pain pathways more irritable so the person can have more pain. So that's the first M. The second M, mechanical, metabolic. The third is the mind-body system. Where are you at mentally, emotionally? Do you have a tendency towards anxiety, depression, fear, catastrophizing? A lot of us have grown up or grown into adult life with a tendency towards thinking everything's going to be the worst, and a tendency towards being anxious, and a tendency towards seeing a little thing and getting all worked up about it and scared about it. So that can be problematic after surgery because there's a trauma, there's pain, and that pain goes right into the mental emotional circuits that modulate anxiety. So trying to give a big picture of some of the things that can make someone more susceptible to having more pain. And those three M's are ways of sort of categorizing it: mechanical, metabolic, mental, emotional. And there are also ways to think about what to do about it. So let's go in order.